In 2017, Maine voters resoundingly supported MaineCare expansion for 70,000 people. Now there's another opportunity to support affordable care for all. There's a bill before the legislature that would restore life-saving MaineCare to our low-income families, friends, neighbors, and coworkers who are immigrants. Throughout the pandemic and recession, we've seen that our community's health, safety, and economy depend on everyone's ability to get to the doctor or fill a prescription. But when getting help depends on a person's immigration status, many of our friends and neighbors can't afford to see the doctor or get the medicines they need. They can end up with health emergencies or no care at all. Maine will be a stronger, healthier, and more prosperous state when everyone has affordable health care.
My name is Hamda Ahmed, and I work at New Maine Public Health Initiative as a program manager, and I live in Lewiston, Maine. It just takes a lot of time and process to fill out that application. And while that time I didn't have any health care, I was just mostly more focused on my case and working alone with a lawyer to have all the documentation that they require. While that time, I needed vision care, dental care.
Immigrants are part of communities all across Maine. They are the backbone of some of our biggest industries like healthcare and food production. Yet the cost of healthcare is out of reach for many essential workers risking their safety and their lives to keep Maine running during the pandemic. And unfortunately, Maine has some of the worst COVID health disparities in the nation. If we're serious about facing our racial disparities in health, embracing policies that help immigrants get access to healthcare is a critical step. From 1996 until 2011, Maine actually provided healthcare for immigrants through MaineCare with bipartisan support. We can pull together for one another, like Mainers do, and restore healthcare that was taken away from our immigrant families, friends, and neighbors. This bill is an opportunity to remove significant discrimination in our healthcare system.
I feel really bad that people doesn't know what's going on in their health until that day that they need an emergency. They have an emergency situation and they have to end up at the hospital, at the emergency room, just because they didn't know what was going on in their life. And at that point, it can be very late and there could be no treatment at that point.
They don't go frequently to the hospital. It's not because they don't want, but because the healthcare is expensive. So when it's expensive, you can see someone can do even 2 years, 3 years without going to the hospital. So the time he gonna be sick, when he go over there, they're gonna say, it's too late, you are sick with this. I've noticed one of our community member who passed away because they discover later on like he was a cancer. So he passed away.
Allowing people from the community to have access to MaineCare is also allowing to the community to build their economy and to have a healthier community that can take care of themselves.
In Maine, a big source of our pride comes from our ability to pull together for one another when times are tough. With this bill to restore MaineCare for immigrants in Maine, together we can make sure everyone is healthy, everyone can afford to see the doctor, to be well, and care for their family. We can take a big step for stronger communities, stronger schools and workplaces, and a brighter, more vibrant future for our state.